Okay, we are back in the Incubator booth at NeoHeart, and we are joined now by Dr. Martina Steurer. Am I pronouncing this correctly?
Yeah, that's good.
Awesome. From your pediatric critical care and neonatologist at UCSF, Benioff Children's Hospital in San Francisco, California. And we are here with Shabnam Peyvandi. From who's a pediatric cardiologist also at UCSF. Thank you both for making the time to be in the booth with us. So we're going to have an interesting, this is so fun to record in New York because the sirens,
yeah.
I've had forgotten about the sirens.
Like we're outside.
But Martina, you're talking about a topic that is so interesting. You're talking about complexity, and the title of your talk tomorrow is From Complexity to Clarity, Improving Risk Adjustment for Neonatal Cardiac Surgery. And Shab, you're talking about the brain-heart connection, unveiling factors that influence fetal brain development. I think these two are quite related topic. Can you tell us, maybe whoever wants to go first, but can you tell us a little bit some of the pearls of your lectures at NeoHeart this year?
Okay, I'll start.
Okay.
So we had a great session this morning on the heart and the brain, and I was specifically focused on the fetal brain and what we know and how it might be influencing, how it might be influenced in the setting of congenital heart disease. And basically the upshot is that there's several factors that are known to affect the brain. Obviously, you're starting with an abnormal heart, abnormal physiology, but we're learning that there are all these other factors that can modify that relationship between the heart and the brain, including social determinants of health, placental health, genetics. So it was a nice review of what we know in the field, but also in terms of future directions. How are we going to synthesize all of this information and identify areas to intervene to optimize brain development in utero?
Which is something that's interesting. I'm a BPD person, and it's been interesting to see in pulmonary neonatal care how the neurodevelopment has become so important that it has directed our pulmonary management, where it used to be make sure you're on as little oxygen as possible, and now today it's, well, if you cannot tolerate therapies, then give the baby more oxygen. And so I think that this shift is interesting, and it seems like this is something that's maybe coming to neonatal cardiac care, which obviously involves cardiac procedures and surgeries. And so do you think that this is really happening? Or?
Absolutely. Now even the most complex heart defects, patients are surviving into their long periods of time. And so we've seen this emergence of the most common comorbidity our patients face are neurodevelopmental differences by far.
Right.
And so it's become this really important topic that we need to address. And it does start not just in the neonatal period, but actually in the fetal period, and thinking of ways where we can optimize those developmental outcomes. They can have a real impact on quality of life and attainment of independence. So it's just an area that we need to be focusing on.
And so I guess this leads exactly to your talk about trying to make something that was already complex and now getting even more complex, maybe simpler. How do we approach these patients, and how do we apply this risk stratification as the title of your talk mentions?
Yeah, I will talk mainly about this risk stratification in neonates as like for mortality models. And I think in general, what we have to realize is how the field shifted to having more and more preterm babies, and also more and more of those preterm babies survive.
Right.
And so that has to be taken into account into the risk models. And we'll spend quite a bit of time on talking about gestational age per se, but also about Z-score for birth weight, so growth, and how both of those are so important. And as neonatologists, we know that this has been quite clear in the non-cardiac population, but it's relatively new, and I think quite underappreciated in the cardiac population.
It has always felt like we couldn't do much about this in the cardiac babies. Like it's difficult to get them to grow, and it's just we try to optimize and try to give them as whatever fluid amount they will tolerate, and cram as many calories as we can, and then will happen. But I'm happy to hear that this is becoming more of a focus in terms of really trying to improve their growth. Yeah.
Very exciting. I think it's interesting that we have you both here because in the spirit of NeoHeart, you guys are in different disciplines, but working at the same institution. So maybe you can speak a little bit about how the collaboration at your institution is changing outcomes for babies.
Well, actually, Martina and I not only work at the same institution, we've co-authored like how many papers?
I don't know, like not too many because there can't be too many, but several.
Several. So we work very closely together, and it's been such a joy because, you know, we bring these different perspectives to the work that we do, and it really speaks to the importance of multidisciplinary work and coming together with our colleagues.
Yeah, and I think we're doing a good job of, you know, we both have our own things, and then we have things that overlap, and I feel like we do a good job of like flow. There's like just like a natural flow. And if
Like
there is,
Yes,
seriously,
exactly.
yes. And it's like, it's so nice to have someone whenever, even if it's frustrating at work or if there's a problem, I always know I can reach out to Shab, and it's really so nice. It's like it's like a friendship that's just amazing.
It's interesting how, right? I mean, it's these collaborations that are very formal, right? You're co-authoring a paper together, but it's building this bridge that then will allow a lot more partnership and collaboration to take place, and improve care for our babies. I think so. I think
I think so too.
Yeah.
I think things that you say or you do has an impact on how how I treat patients, right? I mean, your paper and was published about the blood pressure, like higher blood pressure goals seem to be improving neurological outcomes in hypoplasts. And that really, because she is the first author and I think the world of her, that really is like so in front of my mind whenever I take care of this population.
That's so true.
And I just will add, I think our collaboration has also trickled into the clinical world as well. Martina is the medical director of our newish neonatal cardiovascular center of excellence, and that really was built upon a concept of collaboration across multiple disciplines, and she's building a really fantastic program in our institution.
Yeah.
What I like, the kind of trickle down effect, really, I think clinically means even on our one-off day-to-day conversations, right? We're less hesitant then to just pick up the phone and say, what do you think about this aspect of management? And I think that's where we're really going to see, individual patient, improved success.
And also them not being afraid, like I'm not a cardiologist. So whenever there is an echo question, I can just like call Shab and be like, hey, can you help me? I just don't know.
Yeah.
And like being honest, like I don't know. I have my strengths and my weaknesses. And I think you do the same.
Vice versa.
That's really good. And I think it's a testament to your ability to observe and listen. I mean, it reminds me of what my dad used to say, you have 2 ears, 1 mouth, so you should listen
Twice as much
as you should be speaking. But it is interesting to see how our colleagues from different specialties pay specific attention, like you said, for example, the blood pressure, to things that you're like, to me, that would not have been that big of a deal. But then you see your colleagues and say, this matters tremendously to them. That is interesting. And then just maybe shifting and shaping how we approach these babies later on. So I think that's really cool. Any cool projects in the works since we have the band here?
Well, a lot of our work has been on social determinants of health and outcomes, and Martina is like one of the best data scientists you'll ever meet. So she's been really.
It's not true. So are you.
She's been doing wonderful things with population, large data sets, and we've discovered some really interesting things. And yeah, I think that's kind of the main area.
And co-mentoring trainees, that has been pretty successful to like get them to publish something. So
that's really great. That's really great. And I think I think this is something that social determinants of health tend to be the last thing people look at. And when you have a field as complex and as cutting edge as neonatal cardiac care, it's nice to hear that this is being addressed earlier on, even though we're still finding our footing in how to manage these babies. So I think this is really commendable. Congratulations for working on that.
Thank you.
Thank you both for making the time to come to the booth. This was a pleasant experience. We wish you a good rest of the conference.
Thanks.
And,
this was fun.
Yeah.
Thank you guys.
Thank
more
you.
fun than expected.
Yes.